Hello, and welcome to our annual enrollments presentation for fiscal year 2024. So happy that all of you are able to get on and listen to the enrollment presentation. And then if you have questions, you can certainly reach out and give us a call, and our staff is happy to walk you through any changes that you need to make for fiscal year 2024. I do sincerely apologize that we are not able to go live today due to some technical difficulties, but this recording will be available as soon as we finish here throughout the annual enrollment period. So thanks again for watching. Our agenda today is to talk first about our annual enrollment dates, then we'll discuss our medical plan benefits and our prescription drug plan benefits, talk about some news around COVID-19 testing and vaccines. We'll discuss our dental plan benefits and our vision hardware benefits, our wellness programs, premium payment information, provider networks, and then we'll give you a few enrollment reminders. Our fiscal year 2024 annual enrollment dates are April 24th through May 12th, 2023. So it begins next Monday and will run through Friday, May 12th. Please make sure if you're wanting to make changes that you get your enrollment form with the changes to your campus human resource office by end of business on Friday, May 12th. So first, let's jump in and talk a little bit about your retiree medical plan benefits. I think probably the most important news you're here to hear is that there are no medical plan benefit changes or premium rate changes for fiscal year 24. I'm really excited to be here with you today saying that we are entering year 6 of no detrimental benefit plan changes and no premium increases. In the world of health insurance, that really is a remarkable feat and very unusual. So you will not see any changes to your rates for fiscal year 2024. Your medical benefits will stay the same, and we've just put up a visual of what our copays are for PCP office visits, specialty office visits, your coinsurance, your deductibles, and your out-of-pocket expenses. And then I would remind you that the eye exam, one per plan year with an in-network provider, is covered at $0 copay on your medical plan. For fiscal year 2024, we are adding a hearing exam benefit that will be available for all medical plan members. And this benefit allows you to have one hearing exam at a $0 copay. If you have additional hearing exams, they will be subject to your regular medical benefits and will apply based on whether your provider is in-network or out-of-network. Prescription drug plan benefits will also remain the same. Navitus will continue to be the administrator for this benefit. No changes at all to our copays, coinsurance, or out-of-pocket maximums. Your coinsurance in tiers 3 and 4, remember, do not apply to your out-of-pocket maximum. Those out-of-pocket maximums remain at $2,150 per individual and $4,300 per family for fiscal year 2024. Lumicera will continue to be our specialty pharmacy for the Montana University System Benefits Plan. And just a reminder about a few pharmacies that are not in network for our retirees who are not Medicare primary. So pre-65 retirees, the Western Drug in Bozeman and CVS and Target pharmacies are not in our pharmacy network. If you are not a Medicare retiree and you use these pharmacies, you will be responsible for all charges. Again, this is not applicable to our Medicare pharmacy enrollees. Your prescriptions can be filled at a participating retail pharmacy for either a 34-day supply or a 90-day supply. You likely recall we added that benefit several years ago, and we continue to receive positive feedback from our plan members who appreciate the opportunity to fill a 90-day supply at a local retail pharmacy for their regular medications. You may also fill your mail order prescriptions for a 90-day supply at Ridgeway, Costco, or MyRx. Please just keep in mind that MyRx only delivers to Montana, Idaho, Washington, Wyoming, and North and South Dakota. A few reminders about the prescription drug plan. Medicare eligible retirees must be enrolled in both Medicare Parts A and B as their primary coverage. If you are Medicare eligible and you are not enrolled in both Medicare Parts A and B, you will be disenrolled from the Montana University System medical and pharmacy plans. Medicare eligible retirees who are enrolled in our medical plan are automatically enrolled in the Navitus Medicare RX, which is a Part D prescription drug plan. It does have some nuances that are not available in the Part D programs that you can purchase from the regular market. But what's really important for you to understand is that you cannot go out and purchase another Part D plan and remain on the university system medical plan. Your Part D Medicare RX prescription drug plan is a part of our regular medical benefit. Medicare primary retiree medical plan members cannot be enrolled on another Part D, and it is because of CMS Medicare Part D rules. Okay, so there's no dual enrollment. That's what we're talking about, is you cannot be on another Medicare primary retiree medical plan as a spouse so that you have two plans. Then just a reminder, this is not new, but keep in mind that we do have some split families, and that is where there's a Medicare eligible retiree and a non-Medicare eligible plan member. So when that happens, let's say that you're a pre-65 retiree, so you're not Medicare eligible, but your spouse is 66 and is Medicare eligible, then you become a split family, and the Medicare eligible participant is enrolled under the Part D Medicare RX plan, and the non-Medicare retiree is enrolled in the commercial pharmacy plan. So that's the regular pharmacy plan that we have for active employees as well. You're enrolled into the Navitus Medicare RX as individuals, not as a family. And then your Medicare RX plan accumulators are calculated on a calendar year, which runs from January 1 to December 31. So it's not on the fiscal year like our health plan runs, and that is because of Medicare rules. It's because it truly is a Medicare Part D pharmacy plan that's offered as an employer group waiver plan. Then we wanted to let you know that Navitus will provide the required opt-out period in the fall, and that will run from October 12th through October 29th of 2023. If you do opt out of the Navitus prescription drug program, you will also be disenrolled from the university medical plan. So if you do opt out, you're opting out of medical and pharmacy coverage with the university system. Now, a little bit about some changes that are coming up July 1st, and this is around, really has to do with the end of the public health emergency. The president announced and also signed the bill that ends the public health emergency on May 11th of 2023. So technically, benefits could change on May 12th. We are choosing, as the Montana University System plan, to extend the pandemic benefits through June 30 of 2023. So effective July 1 of 2023, the Montana University System benefits plan will revert to pre-pandemic benefit standards. And what that means to you is, with regard to COVID-19 testing, over-the-counter tests will no longer be covered or reimbursed. And testing for COVID will now be subject to your deductible and coinsurance based on the provider's network status. With regard to COVID-19 vaccines, the plan will continue to pay vaccines provided by an in-network provider at 100% of the allowed amount, and vaccines provided by an out-of-network provider will be subject to out-of-network benefits. All right, let's talk a bit about your retiree dental plan benefits. Delta Dental will continue to administer the Select Dental Plan, and there are no dental plan benefit changes or rate changes for fiscal year 24. So if you have the Select Dental Plan, keep in mind that it is comprehensive dental coverage, and it covers diagnostic and preventive, basic services, major restorative, and orthodontia services. The orthodontia services are subject to a $1,500 lifetime maximum per covered plan member. The rest of your select plan benefits are subject to a $2,000 annual benefit maximum per covered plan member, with the exception of your diagnostic and preventive services. And it's really important that we call that out because the maximum doesn't apply to your routine cleanings and basic x-rays. So what that means is that, let's say you have some catastrophic dental services in July and you use up your $2,000 annual benefit maximum, we still want you to go and get your cleanings, your routine services. So your diagnostic and preventive, even though you've already had the $2,000 benefit maximum paid out, you will still have coverage for your cleaning, your basic x-rays. So with that, we'll move on and talk a bit about the Vision Hardware Plan benefit. Blue Cross Blue Shield of Montana will continue as our vendor partner to administer the Vision Hardware Plan. Please keep in mind, Vision Hardware is for hardware only. Your eye exam, one per plan year, is covered under your medical plan at a $0 copay with an in-network provider. Again, there are no changes for fiscal year 24, no premium changes, no benefit changes. So you may have eyeglass frames and prescription lenses in lieu of contacts. You can have one pair per year, up to a $300 annual allowance per covered plan member. Or if you choose to have prescription contacts in lieu of frames and lenses, it is one purchase, up to a $200 annual allowance per covered plan member. So if you do choose to have contacts, sometimes people say, well, my contacts, they don't cost $200. Well, you might want to make a purchase then that perhaps is a 6-month purchase or even a year purchase, depending on the price, so that you do make the best use of your $200 annual allowance. A few MUS Wellness program highlights. We do continue to offer 2 well checks per plan year. This is available for non-Medicare enrollees. I have been asked recently, though, and even yesterday I was asked about whether Medicare eligible retirees could go to the well check and pay for the well check. And you can do that if that's something that you'd like to do. You'll just be paying, it starts with me directly. And I also want you to know that we do continue to evaluate this benefit. So based on feedback we've received, we will continue to have additional conversations about the well checks. We will continue to offer the Take Control Lifestyle Management Program to our non-Medicare enrollees. And we have the Wonder Health, Hinge Health, Well on Target, and the Blue 365 discount programs that are available to us through Blue Cross Blue Shield of Montana, and all of our plan members over the age of 18 are eligible for those. In addition, Delta Dental offers some value-added benefits. These include Amplifon and QualSight programs. And then we continue to offer our wellness incentive programs via the Virgin Pulse platform, and we're thrilled that we can continue to offer that to our retirees. Our lifestyle management program through Take Control, again, this is for our non-Medicare enrollees, and this is a voluntary and confidential program, and it involves health coaching in a telephonic method. Sessions are held monthly with licensed dietitians, exercise and sports science trainers, and certified diabetes educators. And these are for conditions like high blood pressure, high cholesterol, weight loss, diabetes, prediabetes, tobacco cessation, and maternity. We don't have a huge uptake on maternity with our retirees, but we do want to still let you know that it is available. We will continue to offer the Wonder Health program, which is a metabolic syndrome reversal program. This program offers the opportunity for you to learn skills, not rules, but skills that help you personalize a program through a digital counseling program for metabolic syndrome reversal, weight management, and diabetes prevention. The program includes 10 weeks of counseling and personalized skill building, 10 weeks of skill reinforcement, also customized, and 32 weeks of customized skill maintenance. These are weekly, self-paced, informative online video sessions, and they do include a mobile app skill reinforcement, and habit formation. Interaction with health coaches and an online community are also available for social support. Again, this program is available to all of our medical plan members over the age of 18, and there is no cost to the plan members. We also will continue to offer the Hinge Health program. This is a musculoskeletal management solution, and we've actually received quite a bit of feedback from retirees who have been really pleased that this program is available to retirees. So thank you for trying out the program and for giving us your feedback. This program is an opportunity to conquer pain, recover from injuries, and regain an active lifestyle. It's a 12-week digital program that includes one-on-one health coaching and personalized exercise therapy. When you sign up for this program, you sign up for a specific body part, but the Hinge Health program has evolved, and it does include even more of the body parts and joints than it did last year. So if you didn't think it was for you last year, maybe take a second look now. The program is delivered remotely using mobile and wearable technology, and again, available to all plan enrollees over the age of 18. We also have access to the Blue Cross Blue Shield of Montana Well on Target member portal. This portal has a plethora of information for you. So if you have time, I encourage you to get on and take a look. Some of the highlights of the portal include a health assessment, a member dashboard, an opportunity to explore your well-being, some recommended activities that are posted as My Journey, digital self-management programs, interactive symptom checkers, an opportunity to get blue points and earn rewards. There are personalized wellness challenges and fitness and nutrition tracking. So take a look. This program allows you to earn blue points that you can then exchange for things like apparel, electronics, music, sporting goods. Really, there's a number of items that you can save your points for, and then you can cash them in for items of your choosing. There is the Always On mobile app and Well on Target portal that track fitness and activity in real time as well. Blue Cross Blue Shield also offers us their Blue 365 member discount program. This is for plan members and covered dependents. It gives you an opportunity to save money on a number of value-added health and wellness products and services that typically are not covered by a medical benefit plan. So we've provided the web address here if you'd like to get on and take a look. There might be something that you might want to take advantage of in terms of the opportunity for a discount. Now let's focus for just a moment on the value-added benefits that Delta Dental brings to us, and that includes Amplifon for hearing aid discounts and QualSight for discounts on LASIK eye surgery. So Amplifon offers discounts on hearing aids and some follow-up care. They average a 62% savings off retail hearing aid pricing. They have a nationwide network of providers, a number of leading brands with latest of the best and greatest of hearing aid technology, and a 3-year product warranty. So if you're interested, we have included the website, and you need to call Amplifon, and they have advocates that will help you walk through the process, get you linked up with a provider, and give you all the details on how you access the discounts. QualSight is the provider for discounts on LASIK eye surgery, and it does include pre- and post-operative visits. The average savings is 40 to 50% off the national average price for LASIK eye surgery. They have more than 1,000 locations nationwide and experienced LASIK surgeons who have performed over 7.5 million procedures. And again, we've provided the web address for you. And if you're interested, check that out, and then you can call QualSight. Again, they have advocates who can explain the program, help you get set up with a provider, and get your discounted pricing. Again, we are offering our wellness incentive program for the 2023 calendar year. So this one started in January and runs through December of 2023. Virgin Pulse is our vendor partner through which we have a platform to offer our wellness incentive program. All retirees and legal spouses who are enrolled in the medical plan are eligible to enroll in this program. You can earn reward points by participating in challenges, and you redeem your Pulse cash for items in the Virgin Pulse store. We're excited that we can continue to offer this incentive program to our retirees. And then again, you also can get Pulse cash by attending an MUS Well Check if you're a non-Medicare retiree. Okay, Choices retiree premium payments. It's really important that we talk about this when we are walking through what you need to do at annual enrollment. If you are a retiree and you pay your monthly premiums via direct bill, you will continue to submit your monthly premiums directly to the direct bill administrator, which is Benefitsolver. Benefitsolver does offer some payment options, which include online payments, which can be one-time or automatic. They have ACH payment transaction options, or they can provide physical monthly statement coupons and you can send in a check. If you are an MUS retiree and you pay your monthly premiums via the teacher's retirement system or the public employees retirement system, so if you're paying through your PERS or TERS retirement checks, you will continue to have your monthly premiums automatically deducted. If you need to change your current monthly premium payment option as of July 1, 2023, please reach out to your campus HR office and a benefits rep there can help you make the change. All right, for your enrollment, you will receive your book and your enrollment form in the mail. Those have all gone out, so hopefully you've all received them. If you haven't, they should arrive in your mailbox very shortly. And you can go online on the Benefitsolver platform and look at your payments, your benefits. But to complete your annual enrollment, you do need to fill out an enrollment form and get it to your Human Resource Benefits office by end of business on Friday, May 12th, if you are making any changes. If you do not want to make any changes, you just want everything that you have today to be exactly what you have on July 1, then you do not need to take any action at all. Everything will automatically roll over. If you need to make a change, you're going to drop a dependent, you're going to drop your dental, you're going to make any kind of enrollment change, then please have your enrollment form to your campus Human Resources office by end of business on Friday, May 12th. If you do log into the Benefitsolver platform, this is just a screenshot of what you would see. If it's your first time, you'll see on the right-hand side, you need to register. If you are already registered, on the left-hand bottom, you can see you enter your username and password and you can log in. All right, we always need to talk about some provider network reminders. Blue Cross Blue Shield of Montana offers us a very comprehensive network of providers, both in the state of Montana, around the country through their Blue Card program, and they have some out-of-country providers as well. I encourage you always to check the network status of your providers pre-service. That means before you have your services rendered. Never assume that a provider is in the network. And keep in mind that not only do you have different benefits for in-network and out-of-network providers, but if you utilize an out-of-network provider, they can balance bill you the difference between the allowance and charge, and those typically are substantial. So it really is important that you check it out before you receive services. And if you have questions or problems or you can't find one, you can always reach out to Blue Cross Blue Shield. You can reach out to our office and we'll help you navigate through how to find a participating provider. And in the event that, that you have just a really unique situation, Our ability to help you is much greater if you reach out before you receive services than if you reach out after the services have already been provided. For your Delta Dental Select plan, Delta Dental has both PPO and Premier Network providers, but I do need to make sure you understand that the Montana University System Dental Plan has an indemnified fee schedule for reimbursement, and what that means is we have established the maximum amount that we will pay for a service. So it doesn't work exactly the same way that it does on the medical side. Now, there are still benefits to you for using a Delta Dental PPO or Premier provider if one is available in your area for the services that you need, but it's not a requirement. We have a set allowance that we will pay for dental services. All right, let's talk briefly about some enrollment reminders. Again, our annual enrollment dates for fiscal year 2024 will run from Monday, April 24th through Friday, May 12th of 2023. Again, if you are making changes, you must have your enrollment form to your campus HR benefit rep by May 12th, 2023, end of business. If you do not submit any changes, you will be automatically re-enrolled in your prior plan year benefit elections. Your Choices Retiree Annual Enrollment Postcard, benefit workbooks, and enrollment forms were all mailed the week of April 10th. We are hopeful that you've all received them. If you have not, hopefully you will receive them shortly. Your retiree benefit workbooks will be available online on our Choices website on April 21st. That is today. The recorded Choices benefits presentations and slides will also be available online on our Choices website, and those should be available to you by April 26th. That's all we have for this year. Thank you so much for taking the time to listen to the presentation, to review the information. And if you have any questions at all, please call us. Our staff is ready, willing, and able to help you and happy to talk to you about anything benefits related. Thanks so much. Have a great day.